1. A 65-year-old male presents with dysphagia and significant weight loss. An endoscopy reveals a localized esophageal tumor. Biopsy confirms T1A disease, but the pre-treatment distinction between T1A and T1B is uncertain. What is the most prudent next step in management? A. Chemoradiotherapy. B. Endoscopic resection. C. Immediate esophagectomy. D. Observation and follow-up. E. Palliative care. 2. A 58-year-old female undergoes endoscopic resection for an esophageal tumor. The resected specimen shows T1A disease with clear margins and no lymphovascular permeation. What is the next step in her treatment plan? A. Adjuvant chemotherapy. B. Additional endoscopic surveillance. C. No further treatment needed. D. Radiotherapy. E. Repeat endoscopic resection. 3. A patient with a localized esophageal tumor is being evaluated for surgery. The tumor is confined to the esophageal wall with no evidence of distant metastasis. What is the primary goal of surgical resection in this patient? A. Palliation of symptoms. B. Complete removal of the tumor with clear margins. C. Minimizing hospital stay. D. Performing a partial esophagectomy. E. Reducing the size of the tumor before chemotherapy. 4. A 70-year-old male with T3N1 esophageal cancer is being prepared for surgery. What multimodal treatment approach is most appropriate for this advanced stage of disease? A. Surgery alone. B. Chemotherapy alone. C. Chemoradiotherapy followed by surgery. D. Endoscopic resection. E. Observation and follow-up. 5. A patient with esophageal cancer undergoes a Lewis Tanner procedure. What does this surgical approach involve? A. Cervical and abdominal incisions with gastric pull-up. B. Left thoracoabdominal incision. C. Right thoracotomy and laparotomy. D. Transhiatal esophagectomy with blunt dissection. E. Minimally invasive esophagectomy. 6. A 62-year-old patient is undergoing preoperative assessment for esophagectomy. Which of the following is an essential component of preoperative preparation? A. Bowel preparation. B. Continuation of smoking. C. Enhanced recovery after surgery, ERAS, protocols. D. No nutritional support. E. Prolonged fasting. 7. A 55-year-old male with a history of heavy smoking and alcohol use presents with a newly diagnosed esophageal cancer. In preparation for surgery, which of the following is not recommended? A. Chest physiotherapy. B. Incentive spirometry. C. Prolonged fasting. D. Smoking cessation. E. Nutritional support. 8. A patient with advanced esophageal cancer is considered for palliation. What is the primary goal of palliative care in this context? A. Achieving R0 resection. B. Immediate relief of dysphagia. C. Long-term disease control. D. Prolonged hospital stay. E. Surgical resection. 9. A 65-year-old man presents with progressive difficulty swallowing solid foods, which has now progressed to liquids. He has a significant history of smoking and alcohol consumption. 1. What is the most likely type of esophageal cancer in this patient? A. Adenocarcinoma. B. Squamous cell carcinoma. C. Small cell carcinoma. D. Melanoma. E. Metastatic carcinoma. 10. A 50-year-old woman, with a history of chronic gastroesophageal reflux disease, GORD, presents with worsening heartburn and difficulty swallowing. She has a BMI of 32. Which type of esophageal cancer is she most at risk of developing? A. Squamous cell carcinoma. B. Adenocarcinoma. C small cell carcinoma. D melanoma. E secondary carcinoma. 11. A 70-year-old man from East Asia, who experiences facial flushing when consuming alcohol, presents with progressive dysphagia and significant weight loss. What genetic predisposition may contribute to his risk of esophageal cancer? A. ALDH2 deficiency. B. BRCA1 mutation. C. APC gene mutation. D. HER2 overexpression. E. P53 mutation. 12. A 60-year-old man with a history of smoking and alcohol use presents with dysphagia and a 10 kg weight loss over the past 3 months. An endoscopy reveals a mass in the middle third of the esophagus. Which histological type of cancer is most likely present in this patient? A. Adenocarcinoma. B. Squamous cell carcinoma. C. Small cell carcinoma. D. Melanoma. E. Secondary carcinoma. 13. A 55-year-old obese male with a history of Barrett's esophagus presents for a routine endoscopy. No symptoms are reported. What is the significance of performing an endoscopy in this patient? A. To assess for dysplastic changes. B. To perform immediate surgical resection. C. To administer photodynamic therapy. D. To initiate chemotherapy. E. To conduct barium contrast studies. 14. A 45-year-old woman presents with a 5-year history of dysphagia for both solids and liquids, regurgitation, and significant weight loss. Endoscopy reveals a dilated esophagus with food residue and a tight lower esophageal sphincter, LOS. Barium swallow shows a bird's beak appearance. 15. Which of the following is the most likely diagnosis? A. Gastroesophageal reflux disease, GERDB. B. Esophageal cancer. C. Achalasia. D. Peptic ulcer disease. E. Barrett's esophagus. 16. A 60-year-old man presents with chronic dysphagia, regurgitation of undigested food, and halitosis. An endoscopy reveals frothy saliva pooling in the esophagus and food residue. A barium contrast study shows a tapering stricture in the distal esophagus. Which diagnostic test is definitive for confirming the diagnosis of achalasia? A. Barium swallow. B. High-resolution manometry, HRM. C. Endoscopy. D. Chest X-ray. E. CT scan. 17. A 35-year-old man diagnosed with achalasia is considering treatment options. He is concerned about potential side effects and long-term outcomes. His physician mentions that a certain treatment has a risk of GERD and suggests combining it with partial fundoplication. Which treatment is being described? A. Pneumatic dilatation. B. Botulinum toxin injection. C. Heller's myotomy. D. Perioral endoscopic myotomy, POEME. E. Medical therapy with calcium channel blockers. 18. A 70-year-old woman with comorbidities presents with achalasia and is considered a poor candidate for surgery. The physician recommends a temporary treatment that involves injecting a substance into the loss to paralyze the sphincter muscle. Which treatment is being described? A. Pneumatic dilatation. B. Botulinum toxin injection. C. Heller's myotomy. D. Perioral endoscopic myotomy, POEME. E. Medical therapy with nitrates. 19. A 50-year-old female patient with achalasia undergoes a procedure that involves stretching the loss with a balloon. She experiences relief, but her doctor warns her about a risk associated with larger balloons. What is the primary risk associated with this procedure? A. GERD. B. infection. C. perforation. D. residual dysphagia. E. scarring. 20. A 55-year-old man with advanced achalasia has a severely dilated and tortuous esophagus with significant food stasis. He has frequent episodes of aspiration pneumonia. Despite various treatments, his symptoms persist. What is the next most appropriate management option for this patient? A. Continued medical therapy with nitrates. B. Repeat botulinum toxin injections. C. Serial pneumatic dilatation. D. Heller's myotomy. E. Esophagectomy. 21. A 65-year-old male smoker presents with hoarseness of voice and difficulty swallowing. He has a history of smoking for over 40 years. On examination, he is found to have a neck lump and inspiratory stridor. What is the most likely diagnosis? A. Benign laryngeal tumor. B. Laryngeal squamous cell carcinoma. C. Laryngeal papilloma. D. Vocal cord cyst. E. Thyroid nodule. 22. A 55-year-old female with a recent diagnosis of early-stage laryngeal cancer is considering treatment options. She is eager to avoid extensive surgery and prefers a minimally invasive approach. Which treatment modality is most appropriate for early-stage supraglottic or glottic laryngeal cancer? A. Total laryngectomy. B. Open partial laryngectomy. C. Radiotherapy or transoral laser resection. D. Chemoradiotherapy. E. Esophageal speech therapy. 23. A 70-year-old patient has been diagnosed with advanced laryngeal cancer with extralaryngeal extension. The treatment plan involves surgery followed by additional therapies. What is the recommended treatment for advanced laryngeal cancer with extralaryngeal extension? A. Transoral laser resection. B. Radiotherapy alone. C. Total laryngectomy with adjuvant radiotherapy or chemoradiotherapy. D. Electrolarynx usage. E. Esophageal speech. 24. A patient who underwent a total laryngectomy is concerned about their ability to speak after the surgery. They are informed that various methods can be used to facilitate speech. Which of the following methods involves inserting a one-way valve into the tracheal stoma? A. Electrolarynx. B. Esophageal speech. C. Tracheoesophageal voice prosthesis. D. Voice prosthesis. E. Speaking valve. 25. A patient who has had a laryngectomy is now learning how to use an electrolarynx. They are curious about how this device functions to produce speech. How does an electrolarynx help patients with a laryngectomy to speak? A. By allowing air to pass from the trachea to the pharynx. B. By using a vibrating device applied to the neck to produce sound. C. By vibrating the pharyngeal mucosa to produce sound. D. By providing a way to swallow air into the esophagus. E. By assisting in the use of a voice prosthesis. 26. A patient with a newly placed tracheostomy tube is experiencing difficulty with mucus buildup. What is the most effective management strategy? A. Increase oral hydration. B. Frequent suctioning and humidification. C. Administer systemic antibiotics. D. Perform a bronchoscopy. E. Increase patient sedation. 27. A patient with a tracheostomy tube requires frequent tube changes due to blockage from thick secretions. What should be done to prevent this issue? A. Increase the cuff pressure. B. Use a tube with a larger diameter. C. Use a tube with a speaking valve. D. Regularly clean and replace the inner tube. E. Reduce the frequency of suctioning. 28. In the immediate postoperative period following an elective tracheostomy, what is a critical step to ensure the patient's safety? A. Secure the tracheostomy tube with double tapes. B. Place the patient in a supine position. C. Administer high-flow oxygen. D. Perform daily tracheostomy tube changes. E. Restrict fluid intake to reduce secretions. 29. A patient with a tracheostomy is showing signs of an infection around the stoma. What should be the primary focus of management? A. Apply topical antibiotics to the stoma. B. Change the tracheostomy tube immediately. C. Increase systemic antibiotic therapy. D. Perform an immediate tracheostomy revision. E. Increase oral intake to flush out the infection. 30. A patient who had a cricothyroidotomy in an emergency setting now requires a more permanent airway solution. What is the most appropriate next step? A. Perform an emergency tracheostomy. B. Perform an elective tracheostomy. C. Continue with the cricothyroidotomy. D. Use a nasotracheal tube. E. Insert a permanent airway device through the cricothyroidotomy. 31. A patient with a tracheostomy tube is experiencing significant air leakage around the cuff. What should be done to address this issue? A. Increase the cuff pressure. B. Replace the tracheostomy tube with a larger size. C. Change the tube to one with a higher cuff volume. D. Perform a bronchoscopy to check for tracheal damage. E. Adjust the patient's head position. 32. A patient with a newly inserted tracheostomy tube complains of discomfort and difficulty swallowing. What is a likely cause and solution? A. The tube is too large, replace it with a smaller one. B. The cuff pressure is too high, reduce the cuff pressure. C. The stoma needs immediate revision. D. The patient should be started on a soft diet. E. The patient may need increased sedation. 33. Following a percutaneous tracheostomy, a patient develops a subcutaneous emphysema. What is the best immediate management step? A. Increase ventilatory support. B. Monitor the patient closely and provide supplemental oxygen. C. Perform an immediate tracheostomy revision. D. Administer systemic antibiotics. E. Place a chest drain. 34. A patient with a tracheostomy tube has a stoma that is showing signs of granulation tissue formation. What is the most appropriate management? A. Apply topical steroid creams to the stoma. B. Remove the tracheostomy tube and perform a stoma revision. C. Increase the frequency of tube changes. D. Use a smaller tracheostomy tube. E. Apply a saline dressing around the stoma. 35. During the routine care of a tracheostomy patient, the nurse finds the tube is obstructed by thick secretions. What should be done immediately? A. Replace the tube with a new one. B. Perform suctioning to clear the obstruction. C. Administer oral fluids to thin the secretions. D. Adjust the cuff pressure. E. Increase the patient's sedation. 36. A 50-year-old male with severe obesity presents with acute upper airway obstruction and difficulty breathing. Intubation attempts have failed. What emergency procedure should be considered next? A. Tracheostomy. B. Cricothyroidotomy. C. Laryngoscopy. D. Endotracheal intubation. E. Thoracotomy. 37. A patient with severe head and neck trauma and an unstable cervical spine fracture needs an emergency airway. Which procedure is most suitable? A. Elective tracheostomy. B. Cricothyroidotomy. C. Percutaneous tracheostomy. D. Laryngoscopy. E. Supraglottic airway device. 38. A patient is scheduled for an elective tracheostomy. What is the primary advantage of this procedure compared to emergency tracheostomy? A. It reduces the risk of infection. B. It allows for complete airway control and careful tube placement. C. It minimizes bleeding. D. It can be performed without anesthesia. E. It is easier to perform in obese patients. 39. A patient with an elective tracheostomy has their tracheostomy tube replaced after 3 to 4 days. What is the reason for this change? A. To reduce the risk of infection. B. To prevent mucosal damage from cuff pressure. C. To allow the patient to speak. D. To decrease sedation needs. E. To facilitate eating. 40. During an emergency tracheostomy, heavy bleeding occurs. What should be the immediate step? A. Control the hemorrhage immediately. B. Continue with the procedure without controlling the hemorrhage. C. Abandon the procedure. D. Apply pressure to the wound. E. Call for additional help. 41. A 5-year-old child requires a tracheostomy. What is a key consideration to avoid subglottic stenosis during the procedure? A. Use of general anesthesia. B. Avoid damage to the first tracheal ring. C. Perform a transverse incision. D. Ensure no rotation of the head. E. Monitor cuff pressure. 42. A patient in the ICU with restricted neck movement needs a tracheostomy. What type of tracheostomy is less suitable in this case? A. Emergency tracheostomy. B. Percutaneous tracheostomy. C. Elective tracheostomy. D. Cricothyroidotomy. E. Endotracheal intubation. 43. A patient undergoing elective tracheostomy under general anesthesia should be positioned with A. Head rotated to one side. B. Head extended and shoulders padded. C. Head flexed. D. Shoulders elevated. E. Head overextended. 44. During a tracheostomy, what should be done if the situation is of extreme urgency? A. Make a horizontal incision in the trachea. B. Make a vertical incision through the second to fourth tracheal rings. C. Palpate the cricoid cartilage carefully. D. Control the bleeding first. E. Wait for an anesthetist. 45. A patient has just had a tracheostomy tube inserted. What immediate postoperative care is essential to prevent complications? A. Frequent suction and humidification. B. Administration of antibiotics. C. Bed rest with head elevated. D. Monitoring heart rate and blood pressure. E. Limiting fluid intake. 46. A 55-year-old male who has worked in the furniture industry for over 30 years presents with persistent nasal obstruction and nosebleeds. On examination, a mass is noted in the nasal cavity. What type of malignancy is most likely linked to his occupational exposure? A. Squamous cell carcinoma. B. Adenoid cystic carcinoma. C. Adenocarcinoma. D. Melanoma. E. Lymphoma. 47. A 60-year-old woman presents with diplopia, proptosis, and loosening of her upper teeth. An MRI scan reveals a mass invading the left maxillary sinus and adjacent structures. Which malignancy is most likely responsible for these symptoms? A. Squamous cell carcinoma. B. Adenoid cystic carcinoma. C. Adenocarcinoma. D. Osteosarcoma. E. Rhabdomyosarcoma. 48. A 50-year-old male presents with nasal congestion, facial pain, and trismus. Physical examination and imaging suggest invasion into surrounding tissues. Which sign is not typically associated with sinus or intranasal malignancy invasion? A. Diplopia. B. Proptosis. C. Loosening of teeth. D. Trismus. E. Tinnitus. 49. A 45-year-old woman with a history of minor salivary gland tumors presents with a mass in the nasal cavity. Histological examination reveals a tumor consistent with adenoid cystic carcinoma. From which structures do these carcinomas typically arise? A. Nasal septum. B. Minor salivary glands. C. Maxillary sinus epithelium. D. Ethmoid sinus bone. E. Nasal cartilage. 50. A patient is diagnosed with a malignant tumor involving the nasal cavity and paranasal sinuses. Management is planned in a multidisciplinary clinic. Which specialists are likely to be involved in the patient's care? A. ENT surgeons, maxillofacial surgeons, and oncologists. B. Dermatologists, radiologists, and neurologists. C. Gastroenterologists, cardiologists, and nephrologists. D. Ophthalmologists, endocrinologists, and pulmonologists. E. Rheumatologists, infectious disease specialists, and hematologists. 51. A 45-year-old male presents with nasal obstruction, watery rhinorrhea, and reduced sense of smell for the past 6 months. Nasal endoscopy reveals pale, semi-transparent gray masses that are mobile and insensitive to palpation. What is the most likely diagnosis? A. Chronic rhinosinusitis without nasal polyps, CRSSNPSB. Chronic rhinosinusitis with nasal polyps, CRSWNPS. C. Allergic rhinitis. D. Deviated nasal septum. E. Nasal malignancy. 52. A 32-year-old female with chronic rhinosinusitis is unresponsive to medical treatment. A preoperative CT scan is performed. What is the next best step in management? A. Continue medical management. B. Functional endoscopic sinus surgery, FESS. C. Oral antihistamines. D. Nasal saline douches. E. Immunotherapy. 53. A 50-year-old patient with CRSWNPS has been treated with systemic steroids, which reduce the size of the nasal polyps. After stopping the treatment, the polyps recur. What maintenance therapy can help prevent recurrence? A. Oral antibiotics. B. Topical corticosteroid drops and sprays. C. Nasal decongestants. D. Antihistamines. E. Nasal saline douches. 54. A 40-year-old male with CRSSNPS presents with persistent symptoms despite using topical treatments. His immunoglobulin E levels are normal. Which additional treatment can be considered? A. High-dose systemic steroids. B. Long course of low-dose macrolide antibiotics. C. Immunotherapy. D. Nasal saline irrigation. E. Endoscopic polypectomy. 55. A 35-year-old female with CRSWNPS reports facial pain, postnasal drip, and hyposmia. She is started on a new biological treatment. Which type of treatment is being described? A. Systemic steroids. B. Topical corticosteroids. C. Monoclonal antibodies. D. Oral antibiotics. E. Nasal saline douches. 56. A 60-year-old male with CRS presents with unilateral nasal polyps. What additional investigation should be considered to rule out malignancy? What should be considered in this patient? A. MRI scan. B. Nasal endoscopy. C. High-resolution CT scan. D. Nasal biopsy. E. Allergy testing. 57. A 25-year-old patient with a history of cystic fibrosis presents with nasal obstruction and polyps. What is the most likely associated condition? What is the associated condition in children with nasal polyps? A. Asthma. B. Allergic rhinitis. C. Cystic fibrosis. D. Deviated septum. E. Sinusitis. 58. A 45-year-old female with CRSWNPS undergoes endoscopic sinus surgery. Postoperatively, she develops severe headache and visual disturbances. What is the likely complication? What is the likely complication of endoscopic sinus surgery? A. CSF leak. B. Nasal bleeding. C. Allergic reaction. D. Septal perforation. E. Sinus infection. 59. A 38-year-old male with CRS who does not respond to medical management is scheduled for FES. What important preoperative review should be done? What should be reviewed on the preoperative CT scan? A. Extent of nasal polyps. B. Size of the turbinates. C. Level and symmetry of the anterior skull base and integrity of the lamina papyracea. D. Presence of deviated septum. E. Thickness of the nasal mucosa. 60. A 42-year-old female with CRSWNPS is being considered for a new treatment involving monoclonal antibodies. What is the primary goal of this biological treatment? A. To reduce nasal obstruction. B. To eliminate bacterial infection. C. To reduce the size of nasal polyps and provide long-term relief. D. To improve sinus drainage. E. To increase nasal airflow. 61. A 34-year-old patient with acute rhinosinusitis presents with nasal congestion, facial pain, and mucopurulent discharge. Nasendoscopy confirms inflamed nasal mucosa. Which initial treatment is most appropriate to encourage sinus drainage? A. Oral antibiotics. B. Saline douches. C. Topical nasal decongestants. D. Topical corticosteroids. E. Antral lavage. 62. A 28-year-old female presents with ARS that has not improved with medical management. She has ongoing facial pain and nasal obstruction despite antibiotic treatment. What is the next best step in managing her condition? A. Continue current antibiotics. B. Increase the dose of nasal decongestants. C. Perform endoscopic sinus surgery. D. Add oral corticosteroids. E. Switch to a different antibiotic. 63. A 40-year-old male presents with ARS and a CT scan shows complete opacification of the maxillary sinus. He has been on antibiotics for 7 days with no improvement. What additional treatment should be considered? A. Topical nasal decongestants. B. Topical corticosteroids. C. Saline douches. D. Antral lavage. E. Increase antibiotic dosage. 64. A 50-year-old patient with ARS presents with proptosis, reduced visual acuity, and ophthalmoplegia. CT with contrast reveals an orbital abscess. What is the most appropriate management for this patient? A. Oral antibiotics. B. 4 antibiotics and urgent drainage. C. Topical nasal decongestants. D. Saline douches. E. Endoscopic sampling of pus. 65. A 45-year-old female presents with a 10-week history of nasal congestion, facial pain, and mucopurulent discharge. She has tried over-the-counter nasal decongestants with no relief. Which additional treatment option should be considered for her ARS? A. Oral antibiotics. B. Topical corticosteroids. C. Nasal saline irrigation. D. Endoscopic sinus surgery. E. MRI scan. 66. A 45-year-old male presents with nasal congestion, facial pain, and a foul-smelling nasal discharge. He has a history of recent dental sepsis. Nasendoscopy reveals inflamed nasal mucosa with mucopurulent secretions. Which pathogen is most likely responsible for his condition? A. S. Pneumoniae. B. H. Influenza. C. Moraxella catarrhalis. D. Anaerobic organisms. E. Staphylococcus aureus. 67. A 30-year-old woman reports a 10-week history of nasal congestion, mucopurulent discharge, and facial pain. A CT scan shows mucosal thickening of the maxillary sinus. How is her condition best categorized? A. Chronic rhinosinusitis, CRS. B. Acute rhinosinusitis, ARSC. Nasal polyps. D. Allergic rhinitis. E. Sinus tumor. 68. A patient with a history of chronic sinusitis presents with visual disturbances, proptosis, and retroocular pain. CT with contrast reveals an abscess. What is the most appropriate management step for this patient? A. Oral antibiotics. B. Nasal decongestants. C. Endoscopic drainage. D. Saline douches. E. Topical corticosteroids. 69. A 40-year-old patient presents with a 2-week history of nasal congestion, hyposmia, and frontal headache. Nasendoscopy shows mucopurulent secretions in the middle meatus. Which imaging modality is preferred for further evaluation? A. Plain sinus radiographs. B. MRI-C. CT scan. D. Ultrasound. E. X-ray. 70. A 25-year-old patient presents with nasal obstruction, facial pain, and mucopurulent discharge. Nasendoscopy confirms inflamed nasal mucosa. He is diagnosed with acute maxillary sinusitis. Which of the following treatments is most likely to encourage sinus drainage? A. Oral antibiotics. B. Saline douches. C. Topical nasal decongestants. D. Topical corticosteroids. E. Antral lavage. 71. A patient presents with symptoms of ARS, including nasal congestion and facial pain. Upon examination, there is a concern for potential intracranial complications. Which of the following complications is the least likely? A. Epidural abscess. B. Subdural abscess. C. Cerebral abscess. D. Otitis media. E. Meningitis. 72. A patient with a history of dental infection presents with maxillary sinusitis symptoms. His nasal discharge has a foul smell. What is the most likely cause of his condition? A. S. Pneumonia. B. H. Influenza. C. Anaerobic organisms. D. Moraxella catarrhalis. E. Viral infection. 73. A patient with ARS presents with nasal congestion, facial pain, and a history of recent viral upper respiratory infection. Which bacterial pathogen is least likely to be involved in this patient's ARS? A. S. Pneumonia. B. H. Influenza. C. Moraxella catarrhalis. D. Escherichia coli. E. Anaerobic bacteria. 74. A patient with a 3-month history of nasal congestion and facial pain is found to have inflamed nasal mucosa on endoscopy. Which of the following treatments is least likely to be used in initial management? A. Antibiotics. B. Topical nasal decongestants. C. Topical corticosteroids. D. Saline douches. E. Endoscopic sinus surgery. 75. A patient with ARS presents with bilateral ptosis, proptosis, and ophthalmoplegia. There is concern for a serious complication. What is the most likely diagnosis? A. Cavernous sinus thrombosis. B. Orbital cellulitis. C. Ethmoid sinusitis. D. Frontal sinusitis. E. Maxillary sinusitis.